How's it going? Sensei Derek here again. So this next technique that we're gonna work in the rolling is one of my favorites in everyday life. I mean, for everyone. But you happen to find it particularly relevant to your recovery?
Yes, yeah. So when we were in class in Wanderlust, you had us kind of roll right above the chest area, and it's the exact area that all the doctors are constantly reminding us, you need to be massaging your breasts, you've got these implants, you need to soften that tissue. And at some point, we go through so much acceptance of changes as breast cancer survivors, and we have to do with so much self-love in our body changing all the time, but using our hands and constantly massaging ourselves, it can push us a little bit to the limit, and having a ball help us do the exact same movement was a huge aha moment for me, and it's really what brought us on this journey together.
Yeah, you know, I'll say one of my favorite things about this work, in this like survivor recovery mode and in outside of it, is how we can use these tools and use this practice to get to know, to learn about, to interact with, spend some time with our bodies. You know, even when you haven't gone through some kind of trauma or moving your body and you aren't like having a big fight, we're just not that good as a people, like, you know, touching ourselves and being in our bodies. And I think that has caused a lot of discomfort in the world. So this has always been one of my favorite techniques. Basically what it is, it's called a sternocleidomastoid release. So again, another little anatomy lesson. You're gonna learn some shit whether you want to or not. Breastbone, sternum, collarbone, clavicle, and then this little knot, little sort of bony protuberance back here is called your mastoid process. It's behind the ear. This chunk of tissue is basically interconnected between all three of those, sterno, cleido, mastoid. And it's kind of that, it's that tissue that when you do this thing when you're a kid and you make this face, and your mom's like, don't do it, you're gonna stay like that. That's what we're working. So here's how we're gonna do it. You're gonna find your collarbone. There's a pokey forward bit of the collarbone, and then there's a pokey backwards bit. Those are the technical terms. Your collarbone is basically an S-shaped bone. So I want you to find the pokey back bit, and then you're gonna put this ball right underneath it. Go ahead and put your hand on the ball. Yeah. And then what you want to do is, before you put a lot of pressure, okay, so remember we're kind of above breast tissue, above armpit, and below the collarbone. Try to touch your nose to the ball. Now I want you to do that because it shortens this sternocleidomastoid tissue. Then you're going to give it some real pressure. So push as much as is appropriate for you. Again, listen to your body, go gently, but don't be afraid to give some real sort of engagement there. While you're pushing, you're gonna look straight up to the ceiling so that your nose is still above the trajectory, like above the line of the ball. Keep looking where you're looking. And then I want you to bring your right ear towards your right shoulder. Now you're gonna wanna look away. You're gonna wanna tilt your chin. I don't want you to. Yes, really work to tilt your head. Good. You can give the ball a little drag, a little circle, a little wiggle. You can sort of give your chin a little rainbow arc now. Jostle your jaw out, go like this. I just wanted you to do that, sorry. And then release, let it all go. All right, let it go, take a big breath in. How's that feel?
Love that.
Awesome.